Something new yesterday.
Learned something new. That's good. Climbing back over the table. Hi. Oh, now I feel like we're really low. Oh, well. Hi, everyone. 5-minute chat. We are talking this week and last week about that it's okay to modify your exercise during pregnancy. I was not very active during my pregnancy, and everything was basically slow walking to places.
Yeah, but that counts. Walking
Yeah,
counts.
so that's what I'm saying. It's okay. Because I feel like I feel like the pendulum swings both ways.
Yeah.
Like, don't tell women what they can't do during pregnancy. You should, go do a triathlon. And then there's other people that are like, don't do anything. Please rest, put your feet up, and do nothing at all, right? So probably there's a big range of what people should be doing depending on their previous exercise experience. And
Yeah, and some people just feel way more terrible.
way more terrible. Some people are way more terrible.
Some people have more nausea, more fatigue. I think even subsequent pregnancies, if it's first pregnancy or your fifth pregnancy, they can be very different.
Yeah, I was gonna say that.
Yeah.
Within one human,
Yes.
having different pregnancies, you will maybe be able to get away with things or not.
Yeah, and time of year. So it's a lot hotter in the summertime. Sometimes you don't tolerate as much exercise as you would if you were more pregnant during the winter, further along in your pregnancy in the winter.
Yeah. And especially in the winter here, if outdoor activity is your thing, you just want to be careful because your balance shifts a little bit more through the second and third trimester, and we have slippery sidewalks here. So there's always little things to consider. I think some of the things too are we love for people to do resistance training.
Mm-hmm.
I know that there's some recommendations to move from a bar to dumbbells. So if you're going to do an overhead press so the bar doesn't come down on belly, that you can bail with dumbbells,
or
right?
You can create more space if you need to.
Exactly. And I always recommend using some sort of body weight or resistance versus a Nautilus machine, because I find it gets really hard to fit into a Nautilus machine.
Mm-hmm.
They're not really made for pregnant bodies.
Yeah.
So I end up finding that they need to modify it that way as well.
Yeah.
And then it's okay to modify impact. If you start getting symptoms like urinary incontinence, you start feeling vaginal heaviness, you start feeling pelvic pain, you don't need to be doing a full height box jump. You can do a step up. You can do a jump. There's lots of modifications that can happen. Jumping jacks can be on an incline. They can be step jacks. There's lots of things that can be done. But I think that sometimes if we don't have that education on how to modify, we'll just say, oh, I can't do it anymore, and so we stop.
And if you hate doing an impact, I hate burpees. I will not do them ever again because I despise them. And I'm when I exercise, I want to enjoy my exercise. So to Katie's point, walking counts.
Yeah.
Swimming counts. Biking counts. If you're elevating your heart rate, that counts as your cardiovascular activity. In terms of resistance training, there's more and more research to suggest that doing repetitive, not exciting movements are what actually really helps build functional strength. So that's not high impact work, right? And so if you enjoy high impact, then do everything Katie said, but don't feel like you have to do it to have a good workout.
No, it's not required. And right now the guidelines are recommending 150 minutes of exercise a week during pregnancy. Moderate activity, which over 3 to 4 day period if you can. So we're talking about 20 to 30 minutes of exercise at a time, right?
Yeah. So one way, because people always be well, what's moderate? And that's a 4 or 5 out of 10 on a scale. So 10 would be you're breathless, you can't go any further, you're exhausted.
Yeah.
I always say 4 to 5, go for 2 minutes at the pace that you think is about a 4 or 5. When you're done that 2 minutes, you should be able to say, I love taking care of my pelvic floor and I love being physically active during pregnancy. And you should be able to say that comfortably. That's obviously going to feel different than if you were just sitting in a chair.
Yeah.
But you should be able to carry on that conversation without being super breathless. It's actually surprising. I was running last night and I was testing myself to see if I was
Were you yelling about your pelvic floor while running?
No, I think I was saying
I love my pelvic floor.
I think I was saying old Canada or something like that. So but it's surprising sometimes you don't actually have to be going as intense as you are to fall into that moderate activity guideline. And if you have a heart rate monitor, it's even easier.
That is nice, yeah. Anyways, that's close to 5 minutes. We'll call it that. I'm going to post a seated exercise program later at some point.
I feel like I have a lot of feelings about this topic.
Maybe we need to do a part 2.
Maybe we'll have a part 2.
All right, I'm going to climb over this table. I'm not editing this out.